the ultrasound-guided femoral nerve block, a step-by-step video tutorial. Step 1. Prepare the necessary equipment. The following equipment is required: a sterile blood culture set, 2 large opsites, sterile lignocaine gel, a 10 ml syringe, a 10 ml vial of Marcaine, a brown Stimaplex nerve block needle, not forgetting, an ultrasound machine with a high-frequency linear probe. Shown here is an example of the blood culture set and the nerve block needle. Step 2. Scan with the ultrasound to determine the pre-existing anatomy and site of needle insertion. Remember the mnemonic V-A-N. The femoral nerve is just adjacent to the common femoral artery. It is usually not well seen, appearing as a diffuse area containing nerve bundles. Scan with the probe cephalad or superior enough such that the common femoral artery is well seen. The probe is oriented either parallel to the inguinal crease, or in a transverse position relative to the body, or in a position in between, as long as the orientation allows the best view. Step 3. Prepare the equipment, and clean and drape the patient. Also, sterilize the probe by covering it with the sterile opsites. First, open the blood culture set on a clean trolley. Next, clean the patient's groin with the alcohol swabs. Put on sterile gloves, prepare to fully clean and drape the patient. Use the included alcohol swab to clean a second time, making sure a sufficient area is covered. Finally, paste the sterile lithotomy field onto patient's groin. Remember to expose an appropriate area for the ultrasound probe and needle insertion. Prepare the ultrasound probe by covering it with 2 large opsites. Remember to put sufficient gel over the probe first before covering it. This is to help sound waves travel better across mediums of different density and acoustic impedance. Place the first opsite over the probe as shown. Get rid of any air bubbles between the opsite and probe if any are present. Place the second opsite across the probe as shown. Finally, place the clean probe onto the sterile field. Prepare the rest of the equipment, the needle and syringe, sterile lignocaine gel, etc. Attach the syringe to the needle and expel the air within the tubing extension leading to the needle. The lignocaine gel is used as a coupling gel in place of the standard ultrasound gel. Put a small amount on the groin and scan the area again, confirming the site of needle insertion. Step 4. Perform the femoral nerve block under real-time ultrasound guidance. This is where the fun begins. Lift up the closer end of the probe. Place the needle on the skin. Before placing the end of the probe over the needle, make sure the needle lines up with the center of the probe in as straight a line as possible. Carefully advance the needle and watch the needle shaft appear as an echogenic line on the ultrasound screen. Watch the following clip to have a sense of what this looks like. What are the landmarks with which to inject the local anesthetic? The vein, artery and nerve lie next to each other from medial to lateral. The femoral nerve bundle is not a well-defined structure and is contained within a triangular space immediately next to the femoral artery. There are 3 areas with which to inject local anesthetic. Inject near the base of the femoral nerve triangle at position 1, followed by the bottom of the triangle at position 2, and lastly near the apex of the triangle at position 3. Most of the anesthetic, usually about 80%, should be administered at positions 1 and 2. The end. Hope this tutorial has been helpful.